What if I told you the most dangerous heart attack warning signs aren't always chest pain? In fact, many people over 50 ignore these symptoms because they seem completely harmless. A little nausea, a cold sweat, a dizzy spell, or what feels like simple indigestion. These don't sound like signs of a heart attack, but for some people, they can be the body's final warning before a life-threatening emergency. Every year, thousands of adults delay getting help because they believe they're dealing with food poisoning, stress, or just getting older. By the time they realize the truth, it may already be too late. Today, I'll reveal the last 4 heart attack warning signs that cardiologists urge adults over 50 never to ignore. The final one is especially dangerous because millions of people mistake it for an ordinary stomach problem. Stay with me until the end, because recognizing just one of these warning signs could one day save your life.
Hello viewers, I'm your AI doctor, Dr. Henry Paul. Welcome to my channel. Here, we explore important health topics, uncover the causes behind common medical conditions, and share practical science-based tips to help you live a healthier life. Whether you want to prevent disease, understand your symptoms, or improve your overall well-being, you're in the right place. So, subscribe to the channel, and let's begin your journey toward better health together. At first glance, this may not seem connected to your heart at all. People often assume it's arthritis, old age, or simply sore muscles. But sometimes, your legs are revealing what's happening inside your arteries. Your heart pumps blood through thousands of miles of blood vessels. If plaque builds up in the arteries leading to your legs, it often means plaque is building elsewhere too, including the arteries that supply your heart. Think of your body's arteries as a network of highways. If traffic is backed up in one major highway, there's a good chance congestion exists in others. That's why doctors pay close attention to leg pain that occurs while walking and improves with rest. The American Heart Association explains that this can be a sign of peripheral artery disease, a condition that shares many of the same risk factors as coronary artery disease. The encouraging news? Walking is actually one of the most effective treatments for improving circulation. If your doctor approves, start with 10 or 15 minutes each day. Gradually increase your time. Control blood pressure. Manage diabetes if you have it. And never underestimate the value of quitting smoking. Every step you take is an investment in your circulation. Have you ever felt your heart suddenly flutter, race, or seem to skip a beat? Most people experience occasional palpitations. Often they're harmless. Too much coffee, stress, poor sleep, even dehydration. But when these sensations become frequent, last longer, or occur alongside dizziness, chest discomfort, fainting, or shortness of breath, it's time to pay attention. Imagine the electrical system inside your home. If the wiring sends mixed signals, lights begin flickering unpredictably. Your heart has its own electrical system. It controls every heartbeat. When that electrical system becomes abnormal, the rhythm can become irregular. According to the Mayo Clinic, persistent or recurrent palpitations should be evaluated, especially if accompanied by other symptoms. Sometimes they're harmless. Other times they may point to an underlying rhythm disorder that needs treatment. Simple habits can help reduce common triggers. Stay hydrated. Limit excessive caffeine. Reduce chronic stress through regular exercise, relaxation techniques, or enjoyable hobbies. And if these episodes become frequent or concerning, schedule an evaluation with your healthcare provider. Before we continue, I'd like to ask you something. Have you noticed even one of these warning signs in yourself? Maybe unusual fatigue, shortness of breath, or discomfort that didn't seem quite right? If so, type yes in the comments. I read as many comments as I can because this channel isn't just about sharing information, it's about helping people recognize problems before they become emergencies. And if today's video is helping you, click the like button. It helps YouTube share this information with more people who may need it. Now let's continue, because the next warning sign is one many people overlook for years. Now we're getting into the warning signs that people often mistake for something completely unrelated to the heart. Imagine you're sitting quietly at home. You haven't been exercising, the room isn't hot, yet suddenly, you begin sweating. Not a little. A cold, clammy sweat. You start feeling slightly nauseated, maybe even lightheaded. Most people think it's something they ate, a stomach bug, low blood sugar, stress. Sometimes that's true, but sometimes, your heart is struggling to get enough oxygen. When that happens, your body activates its emergency response system. Think of it like a smoke detector. The moment smoke appears, alarms begin sounding throughout the house. Your body does something very similar. Stress hormones are released, your skin becomes sweaty, your stomach feels upset, your body is trying to warn you that something serious may be happening. According to the American Heart Association, symptoms such as cold sweats, nausea, dizziness, and chest discomfort can all occur during a heart attack. Some people, especially women, older adults, and people with diabetes, may experience these symptoms with little or no chest pain. That's exactly why they're often overlooked. Here's what I tell every patient. If these symptoms come on suddenly, especially with chest pressure, shortness of breath, pain in the jaw, arm, neck, or back, don't try to wait it out. Call emergency medical services immediately. Minutes matter when it comes to protecting the heart. The final warning sign is one of the most dangerous because it's so easy to dismiss. Many patients tell me, "Doctor, I thought it was heartburn. It felt like gas. I took an antacid and went to bed." Sometimes it truly is indigestion, but sometimes it's not. The heart and the upper stomach sit close together. The brain doesn't always distinguish where discomfort is coming from. Think of two apartments sharing the same wall. If someone bangs loudly on one side, the neighbor may think the noise is coming from their own apartment. Your body works in much the same way. Reduced blood flow to the heart can sometimes create burning or pressure that feels similar to acid reflux. The Cleveland Clinic notes that heart-related chest discomfort can sometimes be mistaken for indigestion, particularly when it occurs after activity or alongside symptoms like sweating, nausea, or shortness of breath. Here's the key difference. If the discomfort is new, returns repeatedly, occurs during physical activity, or is accompanied by other warning signs we've discussed today, don't assume it's just heartburn. Let a healthcare professional determine the cause. It's always safer to have your heart evaluated than to miss a serious problem. Today we focused on 4 of the most overlooked warning signs of heart problems after age 50: cold sweats, sudden nausea, unexplained dizziness, and discomfort that feels like heartburn or indigestion. None of these symptoms automatically means you're having a heart attack. But they should never be ignored, especially if they appear suddenly or occur alongside chest discomfort, shortness of breath, pain in the jaw, neck, arm, or back. Your body often sends subtle warning signs before a medical emergency. The sooner you recognize them and seek appropriate medical care, the better your chances of protecting your heart. Your heart has been working for you every second since the day you were born. It has never asked for a break. It simply keeps beating, quietly and faithfully. As we grow older, taking care of our heart becomes one of the greatest gifts we can give ourselves and the people who love us. Whether your goal is to enjoy retirement, travel, play with your grandchildren, or simply wake up feeling healthy each morning, those moments are worth protecting. A healthier future isn't built in one day. It's built through small, consistent choices made every single day. If today's video helped you understand your heart a little better, I'd truly appreciate it if you clicked the like button. It helps YouTube share this information with more people who may benefit from it. If you're new here, subscribe and turn on notifications. Every week, I share practical, evidence-based health advice designed especially for adults over 50. And before you leave, I'd love to hear from you. Which warning sign surprised you the most? Or is there a healthy habit you've recently started that's made a difference in your life? Share your experience in the comments below. You never know who your story might encourage. Thank you for spending these minutes with me. I'm Dr. Henry Paul. Until next time, take care of your heart, take care of your health, and take care of the people you love. I'll see you in the next video.